Thank you, Cathaoirleach. Minister, this question is in relation to seeking an outline from yourself in relation to your and your government's plans to enhance testing and tracing, to put in place a more proactive and a more robust system, and to have in place a system that's fit for purpose and that can be used to hunt down the virus, but also to stay ahead of it. So when we get to a situation, and hopefully we will, that the numbers are much, much lower, and we can come out of this current lockdown, that we will have strengthened numbers in terms of a robust system to aggressively then keep the virus in check.
Thank you, Deputy, and I agree wholeheartedly. The answer here may be a bit long, but I'll supply you with the full one if we don't get through. So on the advice of NEFIT, the HSE developed capacity for to get to 100,000 a week. Now, I subsequently met with the HSE and asked that they look at increasing the capacity. This is in place. They have a standing capacity now of up to 120,000 a week, and progress is being made on looking at going higher than that should we need it. So the testing and tracing regime does compare very favourably internationally in terms of tests per size of population. We rank 8th out of the EU 24 and the UK in terms of number of tests being completed at the moment. So the median time, Deputy, for community referral to appointment is now 0.8 days, with 93% of GP referrals providing a swabbing appointment for the same day or the next day. Median time from swab to communication of a lab result is now 24 hours in community testing, 28 hours in serial testing and 28 hours in acute testing. In the week of the 27th of December, the median time to complete the calls for contact tracing was 1.8 days. The Deputy will be aware that a significant number of staff from other areas of the HSE were deployed to assist in the programme, the testing and tracing programme, and the HSE is now moving these professionals back, which is very important in terms of redeploying people to their frontline posts. My focus now, very much to your question, Deputy, is on what we must do now to minimise the risk of future large increases in positive cases. As I'm sure you'll agree, one of the really important tools is the effective contact tracing, obviously, as well as the testing. The HSE is currently running a nationwide recruitment campaign for swabbers and contact tracers. 180 additional swabbers have been appointed to date, while additional candidates are currently going through the process. 500 additional contact tracers are being hired to provide sufficient capacity for contact tracing, with 280 in place and a further 60 to 70 being appointed on a weekly basis. So by way of comparison, on the mid-September there were 292 people deployed to contact tracing. By the 30th of October it was up to 683 to contact tracing and rising. Thank you. Be read into the record.
Minister, we need capacity and more capacity both in testing and tracing. On the testing side, we need to increase lab capacity. We can have more swabbers, but if we end up then with a bottleneck in the labs itself to do the testing, we have a problem. And in relation to tracing, the problem is the system did collapse for a couple of days, and nearly 1,900 or over 1,900 patients unfortunately became contact tracers themselves. And when the head of testing and tracing was before the Health Committee, she said that the metric that they used to look at how many tracers we actually need in this state showed that we needed 800. And yet, when on the day she was in, and we're in the middle of a second wave, she said we only have 581, which proves the point that many of us have been making for some time, that we wasted the summer months by not putting that capacity in. And two things happened then, which resulted in the temporary collapse of the tracing tracing system. One, lack of capacity. Two, it became overwhelmed, and that's what happened. So don't waste the next number of weeks in the way that the summer was wasted, and make sure that those numbers are brought up to the levels that the government committed to.
Thank you very much, Deputy. We've discussed this in the Chamber before. I just want to say that I don't accept that the system collapsed. I absolutely accept that what happened shouldn't have happened, and a lot of people were asked to contact their own close contacts, and that's not what we want. But I wouldn't see that as the system collapsing. If you look at what's going on in some of the European countries as the cases rise, you did see that. You did see essentially contact tracing stopping. So we didn't see it stop. This was a one-off event. Where they're at now, Deputy, I think importantly, is they have the capacity to rapidly contact trace up to 1,500 new tests per day or new cases per day. In the current situation, the highest number, I believe, was just short of 1,200 and it's falling now thanks to the work of people across the country. But I absolutely agree with you, and what needs to happen now is as the numbers come down and when we come out of level 5, which we will, we have to make sure that the contact tracing system that is in place is very quick, is very comprehensive, and does both forward and backward contact tracing for the very reasons you lay out.
Minister, that a number of people in this chamber were at that committee hearing where the head of testing and tracing was at it, and there was a lot of spin beforehand, by the way, in terms of the public commentary from ministers and even the press statements from government that we would see an additional 800 tracers. As it turns out, it was to bring us to 800, and we were going to go from 581 to 800. But the point I make to you, and I want to make it again, we were told by the head of testing and tracing at that committee that the number that was needed to ensure that we had a safe service, and the metric that they used, was 800. And we were in the middle at that point of a second wave. There was about 1,200 cases a day at its height in terms of this second wave, and we were left only with 581. How did that happen, Minister? It happened on your watch, because you didn't use the summer months to recruit the staff that were necessary to ensure that we had at least sufficient capacity. And I don't buy even that 800 would be enough, which is why I'm saying that don't leave us exposed again. If we get the numbers down, when we get the numbers down, let's have a testing and tracing system that we can use to hunt it down, to keep ahead of it, and we don't lose control in the way we lost control this time.
1 minute.
Thank you, Deputy. Look, we'll just have to agree to disagree, I think, on the system collapsing. As I said, obviously you don't want people having to contact their own close contacts, but as a one-off event in 9 months or so of a global pandemic, I certainly don't believe that constitutes collapse at all. The figure of 800, I can't speak to people saying an additional 800. I'm pretty sure what I have been saying is they're scaling up to 800. They'll have gone from 231 in mid-September to 800, so it's a very significant increase. But as I said, I think what's important now is they have the capacity to rapidly contact trace 1,500 cases a day. We all need to make sure that we never get close to 1,500 cases a day. And we don't know what the future will hold, obviously, but certainly the cases are coming down now. And so the focus is going to be, for the short term, but hopefully for the medium and longer term as well, less on having to do the very, very high numbers and more around speed, getting to people, getting to their close contacts and their close contacts, and going very deep and doing both the backwards and forwards contact tracing.